Today we're going to be demonstrating the clinical usage of the implant bite post. Chris, our patient here, was missing teeth in his upper right posterior quadrant from 2 all the way to 6. Following implant surgery, we did simultaneous sinus surgery and implant placement. We're going to be making an open tray impression and then recording the bite. Now in Chris's situation, we're going to be making a 4-unit fixed partial denture over 2 implants. And the challenge for getting a bite in this situation is that in the laboratory for tripodization, since we're missing all of those teeth, we don't have any way to orient the casts. And traditionally, we may want to use a base plate and wax rim, but that's not stable enough for fixed prosthetics. In that situation, if we did use a base plate and a wax rim, we could approximate the casts in mounting in the lab, but then we would need to fabricate our abutments and then also a framework for our fixed partial denture. Then we'd have to have the patient back, try all of that in, and get another bite record on top of the framework so that it was rigidly attached to the cast. So to avoid those extra appointments, we want to create some surrogate preparations, which are kind of imitation teeth, and that's where the implant bite post comes in. So those are attached to the implants, and then we can get a bite registration over them since they're rigid, and then the lab can fabricate a great bite. Now the bite can be taken before or after the impression. Today we're going to take the bite beforehand. The first step in the procedure is to have the patient close, and then we take a look at the inner arch space and we make an estimate as to how much inner arch space we have. The bite posts come in 2 sizes or lengths. There's a tall and a short. In this case, I've taken a look and Chris has enough room for the tall bite posts. So the first thing we're going to do is remove each healing cap and then place the bite post. We loosen our cover screw or healing cap, and then we take that out. And then we take the implant bite post. In this case it's a tall one. And then we insert that into the hole, and we just use gentle finger pressure, and it usually takes about 3 complete turns, and then it's just finger tight, and then it'll slip in my gloves. And then we'll go back to the back one. Open up a little, Chris. Thank you. Okay. Super. So we'll pull that one out, and then we'll get this other bite post and insert that in the back. Now we have 2 implants in this case because we're making a fixed partial denture. So we have 2 bite posts. We can see that Chris is biting. We have enough clearance over the top of the bite posts so that they don't hit the teeth. And then the ingenious part of these bite posts is now they're rigidly attached to the implants, so they simulate natural tooth preparations, and then we can just get a normal bite registration over the top. We're going to take the jet bite material and we're going to squirt it over the top of the implant bite posts, and I inject it kind of firmly so that it gets all the way around the bite post. Open up a little, Chris. So then we just continue to inject this around the arch. Great. Now I want you to bite together, Chris. Good. And just relax but stay closed, okay? And then the bite registration material will set in a couple of minutes. Okay, open up for me, Chris. Great. So Chris opens, and then we retrieve our bite in one piece, and it's kind of snug on these bite posts, so we're careful to remove that. And then as we see, we have a nice thick piece of the registration material on the side where the implant bite posts were, and it encompasses the bite post completely. And then this can be sectioned in the lab so they can index it, and you'll see in a later video the lab steps. So now that our bite is done, we need to remove the bite posts. Now with some of the implant systems, the connection, this is a conical connection here, so that the posts are in there a little bit snug, and I only used finger pressure if you remember. So in this case, we use a standard 050 hex driver, and then we can insert that, and then we just gently start removing it, and it comes out. Now we don't really want to use the hex driver to seat them, because we get a really tight connection, and for continuity the lab is not going to use a screwdriver to seat them either. They're going to use just finger pressure. So after we remove these, we can take the bite posts and our bite registration material, and then we'll send that along with our impression and analogs and any other lab parts that we want to use in the lab communication. And then they can then do the laboratory portion and assemble a fantastic bite.